Hi, this is Dr. Sumithra, Pediatric Intensivist and Pediatrician at Aster Women's and Children's Hospital at Whitefield, Bangalore. So today I'll be talking about what we commonly see in emergency, what we call it as fits or otherwise known as seizures. So there are certain things which could be, as a parent, could be quite alarming to see your child seizing. So certain measures could help in further complications to happen in your child. So in this video, I'll be talking about what are the things you could do and what are the things you're not supposed to do to prevent the complications. So if in case the child is at home and the child is seizing, what you have to immediately do. So first and foremost, if the child is lying on the elevated surface, imagine your child is on the sofa and starts seizing or having a fit and is vigorously seizing. Most important thing is move the child away from the elevated surface and move to the flatter surface on the ground. This will prevent child from falling from a height and causing further damage to your child. The second important thing is, as a child is seizing, what you can do is put your child in a lateral position. In this position, what we tell it as well as recovery position. Here, we turn the head towards one side, and we also turn the both upper limb both the limbs as well as the body to one side. What we call it as lateral position. It could be either right side or left side. That doesn't make any difference, but make sure your child is put in a lateral position. So how does this help you? So basically what we have seen is these children, when they are having fits, when they are unresponsive, the most complication which happens is because the tongue is going to fall back. When the tongue falls back, it's going to obstruct the breathing. So it's going to cause breathing problems in your child. That can secondarily, if the fits is persisting for longer time, it can have a low oxygen supply to the brain and can cause further damage to the brain. So it becomes, once you put your child in the lateral position, the tongue you can prevent the tongue falling back, and this could help easing breathing of your child. And the second thing what we have noticed is when the child is fitting, they can have the secretions. Because they are unresponsive, they may not be able to swallow their secretions. So your child can just simply choke on his own secretions, which could cause breathing problem, either because of the obstruction of your breathing airway because of the secretions, or it may lead on to going into the lungs and causing further infection, what we call it as aspiration pneumonia. So when you put a child on lateral position, it not only helps the tongue to fall back, it also prevents the secretions moving into the throat, and it could flow out. So that could help in the easing your breathing. So it becomes very important as a parent, to put your child on the lateral position. Other things what you can do is make sure the surrounding is safe. There's any chairs or sharp object, make sure that is moved away from the child. Because when the child is vigorously shaking, you don't know, this child can get secondarily hurt with a sharp object which is nearby. And third step would be, if it is possible, you can put a soft padding surrounding the child so that if the child is vigorously shaking, it doesn't get secondarily hurt. Sometimes you can also place a pillow just below the head. So these are the things. As a primary caretaker, you can immediately do it, simple steps which can prevent further complications. So next, let's go on to what are the things we are not supposed to do. We have seen when they come to the emergency, there are certain things which parents can do which could be quite harmful for your child. So we have seen children being given some sharp object in their hands, like maybe it could be an iron rod or keys. Sometimes when they are vigorously shaking, they could cause secondary injury to any part of the body. So the most important thing is never give any objects to your child who's fitting, or never give key. It's never known to cause any decrease in the seizure activity. It's going to be more harmful. Other thing is that sometimes the parents can try to, because when they are salivating, they can try putting something in your mouth or trying to put the hand in the mouth. Never do those things, because it could bite at that point of fits, or it could be more harmful than being helpful. Third thing is never give any pungent smell. We have seen certain parents, they think the pungent smell could help the child to recover from the consciousness, and never use any of those pungents to make your child conscious. So, in case your child is having recurrent seizures, your pediatrician or a neurologist would have prescribed what we call it as midazolam spray. These sprays are known to decrease the seizures. So basically this can be used. Wait for 2 to 3 minutes. If the child continues to have seizures, you can use these sprays into each nostril as prescribed by your pediatrician or a neurologist. This could decrease the duration of seizures. What is known as if the seizure is persisting more than 5 minutes, it could be harmful for the growing brain of the child. So in case of febrile seizures, so what we have known is if the child has had previous episodes of seizure which occurs only with a fever, there could be sometimes family history as well. If this is there, your neurologist or a pediatrician would have prescribed what we call it as tafresium or clobazam, which could be used to prevent further episodes of seizures. So if your child had previous episode of fever with the fits, it's very important to give the child on paracetamol to decrease the temperature immediately so that the child could be prevented from having seizures. Along with that, we also give tafresium as the dose as prescribed by your pediatrician to prevent further episodes of seizures. So if your child had febrile seizures, discuss with your pediatrician to prescribe them on these medication as per required. And sometimes there are certain measures which we tell as a parent not to indulge your child in certain activities. So if your child is known to have a seizure, probably you have to be away from the swimming pools. And the child is, if the child is going to swimming classes, especially is known case of seizures disorder, where is getting multiple episode of seizure, it's better the child is not put into swimming schools. So these are the do's and don'ts, and it's making this first aid simple measures could make complications less and can be more useful for your child. At our hospital at Aster Whitefield, we have a neurology department with neurodevelopmental clinic where we could image your child. We also have a facility to EEG. So if your child is having a fit, if you could bring them here, we'll be investigating on them whether it's a simple febrile seizures or if the child required further investigations like EEG or CT, and further decision on medications can be taken. Some of them children can need medication to be given for a long term in case a seizure is occurring very frequently without fever, what we call it a seizure disorder. So that decision is again made by a pediatrician or a neurologist. Thank you.